Good afternoon. It's Dr. Rosenfield talking to you today about urinary incontinence. This is something that a lot of people don't talk about, but a lot of people suffer from. Urinary incontinence can happen secondary to childbirth. It can also be related to other medical conditions, but let's focus mostly on our gynecologic patients. Typically, patients that come in with urinary incontinence are going to describe one of two major mechanisms of incontinence. The first one is stress incontinence. That's something that happens when you cough, sneeze, jump up and down, swing a golf club, go to exercise class, whatever it might be. Little amounts of urine that occur typically with those movements, especially sneezing and coughing. That can typically happen after childbirth because some of the support around the urethra, which is the tube that the urine comes out of, has been broken during childbirth. If the stress incontinence is severe, the treatment is surgical. We typically do an operation called a suburethral sling. Great operation, outpatient, minimally invasive, excellent results. For patients that don't have stress incontinence that is that severe, there's also a treatment called Viviv. Viviv uses radiofrequency energy to heat the tissue up along that suburethral space. That might also greatly reduce the leakage and also can help with vaginal tightening. So that is stress incontinence. Urge incontinence is a different type of incontinence. Urge incontinence typically is the one that we see in TV commercials, the gotta go right now type of scenario where there's an overwhelming sensation that one needs to go use the restroom. That's a different mechanism. Typically, the reason why overactive bladder or bladder urgency occurs is more of a mechanical problem where the bladder feels full and the receptors in the muscle of the bladder muscle itself are firing and causing bladder spasm. So that can be treated with medication that blocks those receptors. It can also be treated with a procedure called FemiLift, which is a carbon dioxide laser treatment that we do here at the office. If you've got questions, if you want to learn more about these things, please don't hesitate to check out our website at pearlwomencenter.com or come in for a consultation. We're also happy to review records and give you some advice that way as well. So that's incontinence for today. We look forward to hearing from you, happy to answer your questions, and look forward to potentially treating you in the future. Thanks.